Hi, I'm Dr. Jeff Donatello, and if you are watching this video, then you have a chronic pain of some sort, and you're looking for answers. Well, I've been in the field of pain reduction and mobility and getting people back to life for almost 20 years now, and I have never seen anything like this K-laser. So what I do is, I know you're sitting back trying to figure out if this is for you. What I always try to do is put myself in your position. To you, this is new. This is not new to people that have been using it for the last 3 or 4 years. So I'm going to explain in the next 5-7 minutes exactly how this works, and you can make a decision if this is right for you. And I'll let you know if I feel it's right for you, and between the two of us, we'll get it to work. Okay, so sit back, watch this video. So what we're talking about here is a K-laser. I had a laser for 3 years. It was a class 3 laser, and this is the problem. If you talk to people, there's a lot of misinformation. The class 3 laser spit out, fired out, whatever you want to, however you want to describe it, 500 milliwatts of power. This K-laser does 12 watts of power. That's 24 times the power. That's more depth of penetration. So where my laser before would only go that deep, this one will go way deeper into your skin. And the more depth of penetration you get, the better healing effect you get. So not only is this about healing your pain, but the way I look at it is this. It's about changing your life. This isn't about getting your knee pain better or your shoulder better or your headaches to go away. This is allowing you to walk on the beach with your spouse, to play with your grandkids, to climb a mountain. This is allowing you to get back into life. So this is very important that we make the proper decision, that you become educated about what we're going to talk about today, the class 4 laser. So laser's been around since 1916. Albert Einstein, everybody knows this guy, brilliant, right? Big brain, came up with this therapy. The Russians turned it around where we could use laser therapeutically. So light amplification stimulated by the emission of radiation. And when people hear radiation, they think, uh-oh, danger. This is not the same as X-ray. It's very, very safe if used properly. So the FDA did clear this. So this isn't just something that we're using haphazardly. It was cleared in 2002. The first class 4 laser was in 2003, and this K-laser, the machine that we use in our office, was cleared by the FDA in 2005. So it's all legit. Now, when you hear laser, a lot of times people will think, all right, well, wow, you could burn somebody. And yeah, there is a danger with this, but we're not using it to that level. Lasers do 2 things. There's 2 types of lasers. There's surgical lasers and there's therapeutic lasers. So the surgical lasers destroy tissue. It's really good in getting in there and cutting it, using it as a cutting blade instead of an actual metal blade. Very, very precise, works very well. Totally different type of laser. What we're doing is getting in and healing tissue using a photochemical effect. The wavelength of light that the K-laser uses makes enzymatic reactions that occur in your body to make energy happen very, very quickly. So that's how it works. Okay? So how do they help? Basically, they do one major thing, is they make things, like I alluded to, work very quickly. So they accelerate tissue repair and growth, and this allows for a faster wound healing. But what it does for a lot of you people with chronic issues is that it reduces scar tissue, because scar tissue doesn't have a lot of blood supply. So by improving the nerve and metabolic activity and the vascular activity, getting a better nerve flow and blood flow back to that area, you get healing in areas that could never heal. And really, you want to know what works good? The areas furthest from your heart. So your feet work really well, your knees, extremities. That's why the laser is going to be used on areas that are here, not so much centrally, even though it does work on low back, but it works really good for Achilles pain. I'm a runner. I do triathlons. I've done close to 200 of them. I had Achilles pain for close to a year. I used this thing 3 times. That's what sold me. 3 times with my Achilles tendon, the pain was gone. So it does work. So this is how they help. Now, if you live in Boston or this area, then you're a Red Sox fan. So this really hurts me to say this, but the New York Yankees are another reason why I bought this laser. My brother's an athletic trainer, and when he saw this testimonial from the Yankees trainer, he was blown away, because professional trainers do not do testimonials easily, especially when they're actively working for the team. They just don't do it. Think about it. If the Yankees say it works, then everyone's going to use it, right? At least if they live in New York. Maybe if you live in Boston, you won't. But if the Yankees trainer says, yeah, this works, it works. So watch this 1.5-minute video. This is from the Yankees trainer. Watch what he says, and then we'll get into it a little bit more, okay?
Professional sports teams cannot afford to have their superstars sitting on the bench. especially with the tens of millions of dollars they have invested into each star. The necessity to get star athletes off the sidelines and back onto the field has never been more important. And K-Laser is playing a prominent role in helping athletes recover more quickly from acute and chronic injuries, especially when it comes to treatment for such maladies as bruises and contusions from being hit with 95-mile-an-hour fastballs, tendinitis, and overused muscles.
I'm Steve Donahue. I'm the assistant athletic trainer with the New York Yankees. This is my 25th year in the major leagues and 7 more in the minors, so my 32nd year with the New York Yankees. The K-Laser has been the best laser for us and it's worked well. It's very portable. It travels with us well. We can use it on the airplane as well as in the training room. We use the K-Laser both on acute and chronic conditions. We've used it for bruises, we've used it on tendinitis, bursitis, especially after a contusion. We ice and then laser, and they seem to be responding a lot quicker. I think we've gotten more rapid response and rapid recovery, guys coming back quicker. Our players have really liked the laser. It's helped them. We have a couple players with tendinitis that want the laser. It's a hot item in the training room, guys lining up for it. We would recommend the K-Laser to other athletic trainers, except in the major leagues.
Pretty amazing stuff, right? Well, if million-dollar athletes are using it, it's probably good enough for you or I. So, what conditions can benefit from K-Laser treatments? Well, I talked about how knees and hips and extremities work really well. The best things for this: chronic neck and back pain, carpal tunnel syndrome, repetitive stress injuries, sports injuries, things like frozen shoulder, plantar fasciitis, foot problems. You can even use it for skin conditions. It's really, really good for things like post-herpetic neuralgia. Shingles works extremely well. Any type of neuralgia, nerve irritation, disc herniations. Now, for soft tissue injuries, sprains, strains, that's what they use it for in the sports world. Muscle spasms, it just won't go away. I've used it on people where they're screaming with muscle spasms. We put it on an acute setting and boom, it's gone. Hematomas, where you get whacked to make the tissue heal quicker. Tendinitis, we talked about that. Capsulitis, trigger points that you'll work on, like a massage therapist will work on with these, they melt away. Arthritis, and that's what a lot of you have if you're watching this. You have arthritic joints, and this can really get in there and help heal a lot of that. Now, if you're bone on bone, not so much. But if you have some tissue to work with, some cartilage, that's what we're talking about. So I have to determine that. Ligament, tendon injuries, rheumatoid arthritis, softness under the kneecap, TMJ, headaches, the list goes on and on. So, are there any side effects? Like everything, there is. Okay, we have to be trained in this. Everybody on our staff is trained in this. We've taken hours and hours and hours of study to make sure we do this very safely. Soreness, though, that's what we're talking. Soreness at the laser site. You may be a little bit more sore afterwards. I haven't seen this, but some people will get dizzy as toxins are released, maybe a little bit of lightheadedness. Not a lot, though. For the most part, it's very, very safe. You just have to be on top of it. We have to keep that laser moving because it does generate heat, and that's what we're trained to do. So, scientific evidence. One of my patients went to a PT the other day, and he said, well, the reason that insurance companies don't cover this stuff is because there's not enough scientific evidence, and that's a bunch of garbage. There's over 2,000 studies right now. And yeah, the insurance companies are just behind. It takes them years and years and years to get with the program, and that's the problem here. So we'll talk about ways to pay for this, but insurance, you've reached in your pocket long enough, you went to the PT, you've relied on that insurance industry to pay for you, it's not going to work. It won't make this affordable for you, okay? So, hundreds of double-blind studies, not just studies made up by the company. And again, the FDA has cleared this. I asked, when I first bought this, I said, all right, compare it to ultrasound, and the studies show that it beats ultrasound every single time. If your therapist is using ultrasound on you, it's because either they can't afford one of these machines or they haven't been doing the research. That's really what it comes down to. Ultrasound units should be chucked in the trash, and you're going to see that. And they're starting to be, I threw mine away. So it beats ultrasound every time. Who can't use the K-Laser? This is very important that you let us know this. If you do have active cancer, the K-Laser makes things happen quickly. We don't want to put it over an active cancer or tumor cell because cell proliferation, making those cells rapidly occur and multiply, is not good if you have cancer. So if you have active cancer, please let us know. We're not going to be able to do this on you. And the other thing, if you are pregnant, it's just about pregnant, right? If you are pregnant, let us know that too, because we can't do that. And we also won't put this over your thyroid gland. Those are the three major things. Okay? So what else do we do in the office? Well, that's my job to figure this out. So when you get done watching this video, we're going to sit down and say, okay, what else could help you? Maybe we'll just do the laser on you. But like with the case of knees, there's an amazing knee adjustment that can take your pain away very, very quickly. So what we'll do here is make a program that's right for you, and that's what we're going to talk about. Okay, so that's all we got for you. If you're watching this video in the office, please stand up and make your way to the reception room, and we'll get going with you soon. If you aren't in the office and you want to give us a call, our phone number is 207-438-9339. Call us today. We'll see what we can do for you. My name is Dr. Jeff Donatello. You have a great day. Thank you.